Hello everyone, welcome back to Lamentrix, where concepts are made easy. Today we are going to learn about the second unit, Healthcare Delivery System, from the subject Nursing Foundation 1. Healthcare delivery system means it is a comprehensive net of organization, or we can call it as a technology, or the resources which are responsible for delivering the medical services. So while delivering this medical services, it should include prevention, diagnosis, treatment and rehabilitation of the disease to a population. So it usually organizes how the care is provided or how it is staffed and regulated to improve the health outcomes efficiently. Now let us look into the levels of illness prevention. So preventive measures are taken for healthy people to ensure their safe health, or which helps them to lead a productive and socially useful life. So these preventive actions are measures which are taken even before the development of disease. So coming to the goals of healthcare or the goals of illness prevention is first to promote health. So to promote health means to mainly focus on balanced diet, sufficient sleep, stress management, and avoiding harmful substances and many more. And the second goal is to preserve health. So preserve health in the sense safeguarding or preserving all the dimensions of health, as we have already learned from the unit 1, the physical dimension, mental dimension, as well as the social dimensions of health. So preserving the health in all these dimensions comes under the second goal. And the third one is to restore health when it is impaired, or when a person is ill or suffering with any disease. To restore it is also a goal of illness prevention. And the third one is to minimize suffering. So a person who is in the palliative care or receiving hospice care, so the main goal is to minimize the suffering or the distress the client is going through. Now let us see what are the levels of illness prevention. The first level is primordial prevention, second level is primary prevention, third one is secondary prevention, and the final level of illness prevention is tertiary prevention. The first level of illness prevention is the primordial prevention. What is this primordial prevention? So these are the actions or measures which we take to avoid the development of risk factors. So for example, many adult health problems like obesity, diabetes and hypertension have their origin in the childhood itself. So it is a time where we should check our lifestyles to avoid these types of health problems, like to avoid smoking, alcohol, to avoid junk food, taking balanced diet, going for physical exercise. All these are the lifestyle factors which avoids us to enter into this or develop the risk factors. The second level of illness prevention is the primary prevention. So primary prevention can be defined as the actions, or we can call it as the measures we take prior to the onset of disease. So when we take care or when we take action even before the onset of disease, it removes the possibility that the disease will ever occur. So here the primary prevention also refers to the actions to avoid the manifestation of disease. So this type of actions can be carried out during the pre-pathogenesis phase of disease or a health problem. So this can be accomplished by health promotion. So according to WHO, the process of enabling people to control their health is called as health promotion. So it moves beyond our individual behavior towards the health or towards the social and environmental intervention. So here health promotion mainly means to improve the level of health by preventing illness, right? So here how can we prevent illness? By controlling hazards, to improve fitness and well-being, and also to function well in the society. It means we are trying to be healthy in all the dimensions of health. The third level of illness prevention is secondary prevention. So, secondary prevention means these are the actions we take to stop the progress of the disease in the beginning stage itself. So, when we try to take preventive measures in the early stage, it prevents the complication. So, in simple, we can call it as early diagnosis and treatment. So, it improves the chances for positive health outcomes. So, what are the main aims of secondary prevention is to arrest the disease process or to stop the disease process and to restore the health of a person before it gets worse, and also to protect others in the community from this type of disease. So, these are the main aims of the secondary level of prevention. And as I already mentioned, this stage mainly focuses on early diagnosis and treatment. So, here early diagnosis includes screening programs for early detection of disease, like going for a cancer test or self breast examination to identify any chances of breast cancer, and also for maternal and child health programs, which includes the screening of any congenital malformations in children, and also in order to understand the risk factors for the health problems like diabetes and hypertension. All this comes under early diagnosis, and we can give the prompt treatment for such type of disease to prevent the complications. The fourth level of illness prevention is the tertiary prevention. So, this is defined as the measures available to reduce or to limit the impairments and disabilities. And we can call it as also the stage where we help the client to promote their adjustment levels to their disease condition. In simple, it is the stage where the client has already acquired the illness and now he or she is in the stage of adjustment with that disease or disability or that impairment. So, this is used when the disease process has advanced beyond its early stages. So, in this stage, we are supposed to do the rehabilitation, or we can call it as a combined coordinated use of medical, social, educational and vocational measures of training and trying to help the individual to function in the highest possible level of the function ability, or we can call it as assisting the client in order to do his daily activities or to assist him in all the ways so that he can work by himself even in that disease process or disability. So, here it also includes continuing care. So, it also refers to as the services like health, personal and social services which is provided to the client over a prolonged period of time, because he or she must be having the terminal illness or the disability. So, the need of this continuing health services is increasing day by day these days, and also the decrease in the number of family members today to provide help or assistance to the disabled ones are reducing. So, continuing care is also rendered by the institutions such as hospitals, nursing homes, or daycare centers. All these are available for the clients to assist in their daily life. Now, let us look into the levels of care. As we all know, health is the greatest wealth, and healthcare is the organized medical care that is available for treating and healing the individuals, right? So, as we know, the number of diseases are increasing day by day. In the same way or simultaneously, the bandwidth of healthcare is also increased at various levels. So, healthcare is provided in three levels, such as primary, secondary, and tertiary levels. The first level of care is the primary health care. So, primary health care refers to the care which mainly focuses on the basic healthcare services that can address the health issue faced by an individual. It can also be called as essential health care. So in simple, it is the first level of contact of individual or family or community with the health system where the treatment is provided or the primary health care is provided. So this care does not require any specialist. Here the person or the client can go and meet a general physician where they are available at the primary health care centers in their village or at their sub centers. So in this primary healthcare center or sub center, the physician can provide the maximum healthcare promotion and prevention to avoid the illness or disability. So this is the first level of healthcare, or which is called as the primary healthcare. The second level of care is the secondary healthcare. So this is the next higher level, and individuals reach out to the secondary medical care through referral. For example, they go to the primary health center or sub center. If they feel that the disease is a bit complicated, they refer to the hospital or to the more complex level of healthcare. So at this level, more complex problems or health problems are dealt. So here the care is mostly provided in the district hospitals or in the community centers, as they are referred from the primary health care centers. And in this secondary health care, curative services are also provided, and it mainly acts as a bridge between the advanced medical care and the patient. The third level of healthcare is the tertiary healthcare. So, tertiary healthcare is being provided by a highly specialized health workers available. So, this is the care that comes into the picture, as the referral of the patient is done by the primary or the secondary healthcare. For example, the client first visits the primary healthcare center or the sub center. From there, they are referred to the secondary health centers like community hospitals or district hospitals. From there, they are referred to a higher or complex level of healthcare. So here the individual may require advanced procedures, advanced medical procedures like any major surgeries or transplantation or any replacements, and also it includes long-term medical care management for disease conditions like cancer or any neurological disorders. So here the client requires the highest form of healthcare practices, and they also might require major medical procedures to be done. So advanced diagnostic centers, specialized intensive care units, modern medical facilities, all these should be available in the tertiary medical care. So these practices are being provided or they are a part of government, and sometimes or it can be a combination of both public and private sectors. So here the healthcare providers who are a part of all these three levels of healthcare together provide the medical services for an health issue of a client who comes for treatment or for the service. So in the next video, we will be learning about the remaining topics from the unit Healthcare Delivery System. Stay connected for more clear concepts. If you found this video useful, like, share and subscribe. Thank you for watching.